What was the company doing that was wrong?
We educated our salespeople to great lengths on inpatient reimbursement. We did not educate the salespeople on outpatient reimbursement. So the salespeople were going out to hospitals and to surgeons saying, you need to do this as inpatient.
Which was unnecessary.
Which was unnecessary.
In dollar terms, how much was the company making by virtue of improperly admitting these patients?
The company was charging $4,000 for the product. And the hospital, by doing it as inpatient, was getting about, on average, $10,000 versus on average of about $1,000 as outpatient. So it was 10 times more profitable for the hospital.
And for the company?
For the company was able to charge $4,000 for a product that they probably could have sold for $600 or $700 and done it as outpatient.
So this could have been just $600 or $700.
It could have been, but they would have, I mean, obviously the company wouldn't have made as much money and they may not have decided to go forward. I guess it was a business decision.
And the whole procedure, once they were admitted to the hospital, they could get Medicare to pay $10,000 for.
Correct.
Okay.
Well, I went to a conference in Minneapolis. It's called Medical Alley. An attorney did a presentation on fraud and abuse, and it was just really clear as he went down through his presentation that we were doing most of the things that he said you shouldn't be doing. And so at that point it was very clear. I turned to a colleague and he looked at me and says, maybe we should get our resumes ready. And of course we didn't, but started reporting it internally through the company at that point.
So you tried to fix it from the inside?
Absolutely.
What kind of response did you get from your supervisors?
My immediate supervisor, his response was very good. He said pass it along to the general counsel. I actually put the attorney from Minneapolis who gave the presentation in direct contact with our general counsel. He was completely ignored. Did several reports, written reports, did a in-person PowerPoint presentation with some of my colleagues for the general counsel, VP of reimbursement, and also a bunch of reimbursement managers. In the middle of the presentation, general counsel stops it. I had to, and says, "It's not your job to police the sales force." You know, and at that point.
So the head lawyer of the company was telling you this?
Absolutely, yeah.
How did you take that?
Well, I mean, I told him there I understood what my job was, but we were breaking the law every day and we needed to fix it. And I guess we weren't interested in doing that.
So the company still didn't fix it at that point, right?
No.
How were taxpayers affected by the company's decision to market the product and admit patients for an overnight stay they didn't need?
Well, and you know, you're paying an extra between $8,000 and $9,000 for every case that's done, and that's paid by Medicare. And who pays for Medicare? We do. And so, you know, millions and millions and millions of dollars were spent unnecessarily on the procedure.
I mean, as a salesperson, you know, you love to make money, but you want to make money ethically. And I realized that, while Kyphon was doing really well and we were doing a great thing for the patient, and I don't want to discount that, we did a great thing for the patient, but we were doing a big detriment to the government. And it was a catch-22. And, you know, I wrestled with myself, but I finally realized doing the right thing, sometimes the hard thing is the right thing to do. Well,
as a salesman, you were making a lot of money.
I was doing very well, yes.
What were you mind saying what you were making or about what you were making?
The average sales rep made $220,000 a year.
Wow. So you put that in jeopardy by blowing the whistle on this procedure.
And a medical career, you know, at the time I was 37, planning on being in medical device for the rest of my life, and I did not know what the outcome of this would do to that career.